I want to speak to Ross Abbott. He is a British Army veteran, and Ross, some concerned statistics about the number of military veterans who take their own lives. Good morning.
Good morning, Ian. Yes, definitely. New reports out saying that suicide within the armed forces, and then within the veteran community as well, is on the rise.
Have you got any figures in front of us that you could tell us about?
So in 2023 we had 19 serving personnel in British Armed Forces died by suicide. And when we look at veteran communities, kind of the last couple of years, we're looking at 253 veterans died by suicide. But what's quite alarming is, even though those figures are slightly below what we see in the national average, when we look at 24-year-olds and under, we're actually double the UK trend for the general public.
I mean, it's obviously a difficult thing to analyse, and we've all got our theories about why so many people harm themselves after serving in the forces. Why do you think they do it?
So for me, being a veteran myself, I'm very lucky that I now work within the wellbeing world after my own struggles with my mental health. I think there's a real challenge, especially for veterans, transitioning to civilian life. There's a change of structure, purpose. Camaraderie starts to go, and changing in this civilian culture. I really struggled with some of the experiences I had within the forces. Coming into the civilian world, it kind of was on a different moral gauge, if that makes sense.
Go on, to explain that a bit more. That's interesting.
Yeah, no. So, I served operationally in Bosnia, Kosovo, and the Gulf. Very much driven by, we're following orders. This is what we have to do. And, I was quite young at the time, and just, I thought that was part of what normal life was. However, transition into civilian life when I retired at 40, I realised that actually, no.
I've spoken to someone about this before, and he said it's the violence. You can't, you'll go from a place where hurting someone is kind of the norm to a supermarket aisle where you hardly ever speak to anybody. And it was like all the things I'd based my morality on had gone out of the window as soon as I left the military.
Yeah, no, definitely. But also, as I said, that camaraderie, you're all together, you're all experiencing the same thing. But as soon as you walk into civilian life, we've got such a beautiful blend of different perspectives where you kind of don't get that within the military.
Fascinating. Okay, how can we help?
I'm very lucky that I work with an amazing organisation called a charity called Ripple. And actually, this is about integrating it's a digital crisis intervention tool that can be put onto Wi-Fi, can be put onto servers, and basically it acts as a kind of filter. So if people are accessing harmful information online about self-harm, suicide, actually it starts to present visual prompts that can support. There's great research out there that says we've got right until the moment that someone acts on a suicide ideation to actually do something about it. We have got the chance to save life.
Okay.
We need to raise awareness. Suicide, unfortunately, isn't going away, but what we need to do, from in my perspective, is really look at the root causes of things. Rather than just saying someone has died by suicide, we need to think about the why. Why did that happen?
Yes. Okay, it's called Ripple, yes?
Ripple, yeah.
Thank you, Ross. Keep up the good work. Ross Abbott, British Army veteran.